Howdy, today's lecture is on practicing occupational health and safety procedures. Our main objectives are identify hazards and risks, evaluate hazards and risk, control hazards and risk, and maintain occupational health and safety awareness. So, hazards and risk identification and control is the first thing that we'll be talking about in here. So, we have here Occupational Health and Safety Audit System. We also call this the OHSAS or the OSAS. So it was in 2007. Many organizations implement this one, the Occupational Health and Safety Management System also, some as they call it, as a fundamental part of their risk management strategy to address changing legislation and protect their workforce and other persons working under their control. So, of course, each company has a system to protect its workers from harm or from hazards. So, hazard identification, risk assessment, and determining controls are or is one that is being addressed by this OHSAS 18001 2007. The second one is legal and other requirements, the objectives of the OHS program, and the resources, the roles, the responsibility, accountability, and authority. So once you go to a company, you become part of a company, make sure to know the rules and guidelines of your company on health and safety. Also, it addresses the areas of competence, training, and awareness, communication, participation, and consultation, operational control, emergency preparedness and response, especially that we are in a city wherein we are prone to like flooding or typhoons and earthquakes. Performance measuring, monitoring, and improvement. And we also have the ISO. This is another organization that um, checks the health and safety protocols of the companies. So this is a new standard for occupational health and safety management systems. So ISO stands for International Organization for Standardization. It's a developing a new standard for occupational health and management safety systems. In Baguio City alone, there are many companies and even schools that are implementing this or that are having this ISO accreditation. So, ISO will be looking into the different aspects, but most especially on the occupational health and safety management systems of the company to make sure that the workers are safe. Okay, so ISO, Organizational Safety and Health Protocols. That is the OHS. And what is this? So when we say occupational health, it concerns the physical and mental health of workers. So it is focused on the physical and mental health of workers. Well, these two goes along with each other, and it includes the study of work methods, conditions of work, and the factors in working environment that may cause diseases or injuries. So again, occupational health will make sure that the workers are being taken care of. There. Also, it concerns the protection of workers' lives and physical well being by eliminating or controlling risk in the working environment or the system of work with which the workers operate, especially if it is a company that deals with chemicals. So there are hazards there. And of course, in any other company that are faced or with, yeah, hazards daily. So we are also going to study this institutional and individual categories. So under this one, we have the safety control and emergency preparedness. You must have noticed that every month of July, it's the disaster Preparedness Month. We usually have a series of trainings and drills. So we have the earthquake drill, we also have the uh, fire drill, and all the other drills. So this is an incident or accident investigation analysis, recording and reporting. And also the this one would include the list of programs or activities in promoting housekeeping. Of course, in housekeeping, you have to take care of not only the clients but also the workers. And safety innovations and activities, records of machine preventive maintenance program. Of course, there should be some preventive maintenance program. The safety control and emergency preparedness still records of downtime, running time, and production schedule, especially if they are or you are in a factory or like a restaurant or a bakery, for example. List of personal protective equipment of the PPE. So, are they provided? Is there proper PPE? Records of fire safety orientations and drills conducted. Are they being conducted? So, whether we like it or not, they are supposed to be conducted in companies for the safety of the workers. Records of maintenance of firefighting facilities. Um, they would also during the audit, they would look for the fire extinguisher or the placement of the kitchen, for example, the stoves. Are they safe there? Emergency preparedness plans and related training. Next one is we have the industrial hygiene program. So under here, it's more focused on the chemical safety. So under the chemical safety, we have the inventory and chemical safety data sheets. There should be a list of what are the chemicals that are in a certain room or in a certain place. Proper labeling, handling, and storage of chemicals. We cannot just put them anywhere there because they are chemicals. Some could be corrosive, some could be explosives, and the like. Emergency contingency plan. There should be an emergency contingency plan also. The waste management and disposal. How is the waste management and disposal? Are they just being left there by the rats to feast on? So is there also a appropriate PPE? Still under this industrial hygiene program is the regular work environment measurement or the WEM and the compliance to threshold limit values, which is called the TLVs, and we'll be talking about that later on. The continuous workplace improvement and control measures. Under the occupational health program, we have here the list of medical staff and employment status. So, is there a even a clinic, or is there even a what's that? First aid kit? Yeah, ready to get or ready to use. List of clinical, dental, and medical equipment, annual medical report for the past 5 years. That's why every year each employee is being required to submit a medical certificate. So there, that's very important. Under occupational health program, we have the establishment's medical records for the past 5 years there, as I mentioned a while back, including analysis. Then we have the health maintenance organizations or the HMO in-house health services or both. So there could be a nurse who is in standby. We have an infirmary if needed there. And we also have the medical services and programs implemented. So what are the those ones? We have the basic medical attention, the pre-employment medical certificates, annual or periodic medical checkups, transfer, okay, separation, dental examinations, special examinations, and others. Then we also have other occupational health programs like the hearing conservation program, respiratory program, protection program, occupational health surveillance programs, blood lead. Probably there have been some companies who are going against these protocols, and so it caused the hearing of some of their workers. So it's very important for a company to have this occupational health program. And they also have the special occupational health programs on workplace drug prevention program, which is very important, the HIV or AIDS prevention, family welfare program, whether we like it or not. Members of workers could be family members or yeah, family men and women. Anti-sexual harassment also, tobacco, TB in the workplace, prevention of lifestyle-related diseases, and others. Then we also have the environmental protection and community relations. So under this, we have the compliance with government regulations. We have to protect our environment, and that is our part in the community as a company. So we have to comply with the regulations of the government. So the PCO or the employment of accredited pollution control officer, their classification and segregation of waste, especially in our city. We are very strict in the segregation and classification of our waste. Pollution control facilities such as wastewater treatment, air cleaning device for hazardous air emission, and proper disposal of waste is also very important. Still, under environmental protection and community relations, we have environmental protection programs such as marine forest preservation. That's why some companies they would go for tree planting activities, but we are lucky in our city. We don't have sea nearby, so we cannot go for marine preservation activities, only forest preservation. Then we also have the system of responding to issues and concerns, unresolved complaints, allocated budget for community development. There we go for what's this extension programs like um, yeah, organizational programs that could help the community. So, community extension, they're continuing assistance to the community. We can also adopt a community. So, a company can adopt a community, and um, they go there every now and then to give assistance to them. And we also have the social accountability program. So, under this one, we have the policy on gender. Well, this is a hot issue nowadays on gender. Yeah, probably there will come a time when even in the Philippines we'll be having some toilets for the other genders other than male and female. Policy on persons with disability. Okay, this is also very important. Employment of PWDs. Yeah, so gone were the days when people are being discriminated in job or yeah in employment because they are people with disabilities or yeah people with special needs. Other corporate social responsibility or CSR programs. So that's under the social accountability programs. We also have the capacity building on OSH. So we have here the list of required orientations training. So under this, the OSH is the basic occupation safety and health training, construction safety training, management systems, so chemical safety, drug abuse, HIV, gender sensitivity, and so on and so forth. So mostly on trainings and orientations to just spread awareness in the workplace about these ones. Then we also have the training calendar and other staff development activities. So nowadays we do webinars, plans on communicating, how do we relay, then we have the information program materials and dissemination strategies and the monitoring and evaluation. And of course, with this OHS MS International Safety Rating System and others, okay, the copy of certification is very important. When you go to companies, they usually display like the ISO certification or other accreditation companies or agencies. So we also have the outcome or the OSH indicators and productivity. So we have here the comparison of safe man hours and severity frequency rates between 2012 and 2013. Oh, this is quite some years ago. Comparison between machine uptime in 2012 and 2013. So comparison in resources savings in 2012 and 2013, and comparison in 2012 and 2013 updates. These are only examples, of course, meaning you try to see is there any progress, okay, in the outcomes in this field. Then we go next to the threshold limit value. We mentioned this one a while back. This is the TVL or the TLV. And what is this about? So the TLV, strictly speaking, is reserved term for the American Conference of Governmental Industrial Hygienists. But then we are also using it here in the Philippines. And what is this? It is sometimes loosely used to refer to other similar concepts used in occupational health and toxicology. So, along with the biological exposure indices are published annually, it's the chemical substance level to which it is believed a worker can be exposed day after day for a working lifetime without adverse health effects. So the threshold limit value in here is how exposed are the workers to um, chemical substances, and there would be no without bad or something extreme adverse health effects. But you have to remember, guys, that even if you are exposed for a very small amount of chemical, mercury, for example, for minors, or yeah, those chemicals that they use, even if it's just a very small amount, if the exposure is very long, there could be an adverse effect. Okay, so the TLV is an estimate based on the known toxicity in humans or animals of a given chemical substance and the reliability and accuracy of the latest sampling and analytical methods. Meaning, in a certain company, they have to know what is the TLV or the threshold value limit so that they would know how exposed their workers would be in handling or in chemical substances. So there should be a limit. So even the law is saying something about that. Okay, and that is the TLV. The Philippine OHS standards is here to protect, to assure the conservation of man, of course, to a human, to prevent hazards and the total development. So the objective of this standard is to protect every working man against the dangers of injury, sickness, or death through safe and healthful working conditions, thereby assuring the conservation of valuable manpower resources. Remember that manpower is very important for a company to run, or yeah, for a company, for a team to run. So, and the prevention of loss of damage of lives and properties consistent with national development goals and with the state's commitment for the total development of every worker as a complete human being. So these standards shall apply to all places of employment except otherwise provided in this standard. So the Philippines gave us a certain standard on health and safety standards that each company should know to protect their workers, to assure the conservation of the lives of the workers, to prevent harm or death, and the total development of their employees. So the effects of hazards in the workplace, of course, even if we will not be discussing this or researching this, it's known already that there could be effects of hazards in the workplace, like um, an effects to the whole parts of the body, all parts of the body, perhaps, or maybe just parts of the body. An important consideration is how exposure occurs. Also, how exposed is a certain individual to a certain chemical. So the acute effects depend on the degree of exposure. That's why we are talking about these ones, that we also have that TLV for the company to know the limit of the exposure of a certain individual to a chemical content. And of course, we also have our PPEs, and that's the importance of having PPEs. But whether we like it or not, there are also companies who are not compliant to this one. And so the workers cannot do anything because if I do not just do my job, even without the PPE, then where would I get my food on the table? See, so they have no choice. So it's very important for you as students to learn this one so that when you are in the workplace, you know your rights, that you have to know that there is a certain standard on the health and safety of the workers. Okay, one thing very important also in the workplace is the ergonomics. So, what is this ergonomics about? It is the design of all the things that will give comfort to the worker. Okay. Remember, if you are working comfortably, there would be a better output compared to when you are working uncomfortably, right? So, when we say ergonomics, this is the practice of designing products or systems or processes to take proper account of the interaction between them and the people who use them. So, are they properly is the environment suited for the job that they are doing? Do they feel comfortable working there? So we have here by the way, we have there the term HF&E, which stands for Human Factors and Ergonomics. So under this one, the HF&E is employed to fulfill the goals of occupational health and safety and productivity. Of course, as I've said, if you are more comfortable, more you would be more productive in working. Human factors and ergonomics is concerned with the fit between the user, equipment, and their environments. Komportable ka ba sa paggamit ng equipment na yan? Especially is if gumagana ba ng maayos ang equipment na yan. So that's one thing that you have to take into consideration under ergonomics. Yung upuan mo, for example, you are working in an office and is the chair even comfortable or are you having backaches? Well, aside from the fact that you have been staying too long sitting down, meron pa rin dapat ergonomics dyan, titignan pa rin kung komportable ba yung working environment. So, environmental compliance certificate is very important. This is an example. Okay. So, what is this? The ECC is any project in the Philippines that poses a potential environmental risk, such as mining, agricultural projects, and construction. Therefore, they are required to come up with an environmental compliance certificate. So, hindi basta-basta na when you put up your mall, for example, and you're going to cut the trees, hindi pwedeng you will just be cutting the trees. You will have to have the environmental compliance certificate. Dito tayo nagkakaproblema. Kaya maraming oppositions sa SM when they started cutting the trees. Kasi nga, most the people who are complaining knows this one, the environmental compliance certificate. Well, if they were given, how come? Why were they given? So that is the question. Were they given in good faith? Yun din yung isang katanungan doon. Because this is being given by the DENR. Of course, that is the proper agency for that. Next is the safety regulations in the Philippines. So under this, we have the Clean Air Act. Okay, it's quite long. So the state shall pursue a policy of balancing development and environmental protection. To achieve this, the framework for sustainable development shall be pursued in such it shall be the policy of the state to, eto na, formulate a holistic national program of air pollution that shall be implemented by the government through proper delegation and effective coordination of functions and activities. Hindi gawain ng isang tao lang, gawain ng everybody. Encourage cooperation and self-regulation among citizens and industries through the application of incentives, market-based instruments. So the focus is primarily on pollution prevention rather than on control and provide for comprehensive management program of air pollution. The point here is the Clean Air Act is on prevention pollution and not dealing with the pollution. Andun na yung pollution, tapos anong gagawin mo? That's not the point of the Clean Air Act. Anong gagawin mo para walang air pollution? Promote public information and education. That's one. To encourage the participation of an informed and active public in air quality planning and monitoring. We have to inform each and everyone that it's not the job of only one individual or only one agency in the government, but the job of everybody, and formulate and enforce a system of accountability for short or long term adverse environmental impact. We can see it in the news, for example, that nature is getting back at us. And so we have to be accountable of these pollution that we have in our environment. So this shall include setting up or funding a guarantee mechanism for cleanup, environmental rehabilitation, and compensation of personal damages. Dito lang medyo nagkakatalo kasi nga sabi kanina, it's to prevent pollution. Tapos, it shall include, sa bagay, it shall include. So, kasama na din yung paglilinis, clean up or rehabilitation. Well, uh, two. Pero the best, I think, would be the prevention of pollution. How do we prevent pollution? There. And of course, we also have this electrical and fire safety code. So it's the policy of the state to ensure public safety when it comes to fire. So the National Fire Protection or the NFPA, the Fire Code of the Philippines in 2008, we also have that. And of course, the Bureau of Fire Protection. Yun yung mga agencies that will focus on the electrical and fire safety code. Towards this end, the state shall enforce all laws, rules, and regulations to ensure adherence to standard fire prevention and safety measures. Ang sinasabi lang nito, we have to know the organization should be aware of the fire code of the Philippines, and they should know, they should be able to relay it to their workers, that each worker should know about this one. Because it's also the job of each individual in a community or in the society, not only for one. Next is waste management. So, under waste management, we have here separate, reuse, use, refurbish. We have the use. Okay, let's see. RA 9003 describes solid waste management as a discipline associated with the control of generation, storage, collection, transfer, transport, everything about garbage or about waste. So the manner by which these activities are conducted shall be in accord with the best principles of public health, economics, engineering, aesthetics, and the like. So meron tayong sinusunod din lang. Hindi basta-basta tinapon mo na lang tas may kumuha tapos na. You have to know that there is a process to that. So the act provides for a comprehensive ecological solid waste management program by creating the necessary institutions and mechanisms and incentives, appropriating funds, declaring certain acts prohibited, and providing penalties for those who are going against this. Okay, Republic Act. Okay. I've also seen some Republic Act on no dumping. If you will be dumping garbage anywhere, then there is a penalty and even imprisonment. Same thing if you are burning your garbage. So solid waste management is very important. Next is the disaster preparedness and management. So, actions here taken by the organization in response to unexpected events. Dito, lumalabas yung mga trainings natin o kaya yung mga drills natin that we have mentioned earlier. It also includes the development of disaster recovery plans for minimizing the risk of disasters and for handling them when they do occur. So it's just the before, the during, and the after. You have to be ready. What do you do before? What do you do after? And what do you do during a catastrophe? We have here also the contingency measures and the procedures. So, contingency measures and procedures. So, it is a course of action designed to help an organization respond effectively to a significant future event or situation that may or may not happen. We are just trying to foresee. It may happen, it may not happen, but still we are ready. So, a contingency plan is sometimes referred to as the plan B. And sometimes they even say that there should also be a plan C. Next, we also have the operational health and safety procedure practices and regulations in the Philippines. So this one, the Occupational Safety and Health Standards or the OSH standards, was formulated in 1978 in compliance with the constitutional mandate to safeguard the worker's social and economic well-being as his physical safety and health. So dito naman, nakafocus na siya on the worker's social and economic well-being. Kasi kanina, yung focus niya is on the physical and mental. Ayan. So, emergency-related drills also and trainings in the Philippines. We also have that. Under this, we have the Philippine Disaster Management Program. Ayan, on disaster preparedness. Okay. And we also have the programs, projects, activities. Ito yung samples na activities ng PAGASA. We have here the special tropical cyclone, reconnaissance, information dissemination, and damage evaluation or the STRIFE. A quick response team. Ayan. We also have the provision of farm weather forecast and warning services provides weather information related to plant growth development and farming operations. Yeah, of course, especially uh, for the farming industry and the public and education campaign. This is also very important. For FIVOX, they also have their programs and activities such as the volcanic hazards identification and mapping. Oh, this is something good. We have to know. We just do not know we are under a hazardous volcanic area. Hazardous volcanic products and process also. And we have the National Lahar Mapping Program. Ayan. And you are the last line of defense in safety. It boils down to you. So the most important point in this module is that you are the workforce and you are very important in the company. Therefore, the company should know how to take care of you. So it boils down to you, sabi ni Kina Rep. I'll see you again in the next video.